Dr. Masbooba.
Good afternoon all. I am presenting on outcomes of posterior chamber phakic IOL in stable keratoconus. We all know that keratoconus is a progressive non-inflammatory corneal degeneration with stromal thinning and ectasia leading to myopic astigmatism and in advanced cases scarring. And we use phakic IOLs to correct the myopic astigmatism in stable keratoconus. There is superiority in postoperative visual performance, and it's safe and effective in the correction of moderate to high astigmatism. The skills required for insertion are similar to those in cataract surgery. The equipment needed for IOL implantation is less expensive than the excimer laser and similar to that of cataract surgery. And it is removable, therefore the refractive effect is reversible and natural accommodation is preserved, and there is lower risk of endophthalmitis and postoperative retinal detachment. We done study in June 22 to March 24. It is a prospective intervention study in patients presenting to the tertiary eye care center. Sample size is 25. Our aim is to evaluate the visual and safety outcome of posterior chamber phakic IOL in stable keratoconus after refractive error correction. And our objective is to analyze the improvement in uncorrected visual acuity, best spectacle corrected visual acuity, manifest refraction, endothelial cell count, day 1, week 1, 1 month, and 6 months follow-up. Our inclusion criteria, 21 years and above, stable refraction after collagen cross-linking, less than stage 2 keratoconus, contact lens intolerant, clear central cornea with pupil size less than 6.5 mm, angle width more than 30, and exclusion criteria, progressive keratoconus, and endothelial cell count less than 1,500 millimeter square. Other eye diseases like cataract, glaucoma, retinal detachment, or retinopathy. Our methodology, we have taken the informed written consent from all the patients who fulfill the criteria, and we detail history of the patient and refraction, both all the uncorrected visual acuity, best corrected, manifest refraction and cycloplegic refraction done, and all the investigations are done, and detailed anterior segment and posterior segment examination is also done. Results, most of the people were between 26 to 30 years of age. Our cutoff was 21 years, and elder one was 33 years, and male patients were 56%, and I involved left eye, right eye 56%. Our objectives, like uncorrected visual acuity, preoperative, it was 0.96 logmar units. It improved to 0.032 logmar units in 6 months, and best corrected visual acuity, which was 0.25 logmar units pre-op, and it improved to 0.02 logmar units post-op 6 months. And sphere, which was minus 3.8, improved to minus 0.5 diopters post-op 6 months. And cylinder, which was minus 4.58, improved to minus 0.03 at 6 months follow-up. Spherical equivalent, which is minus 4.13, improved to minus 0.3. And endothelial count, it was 2,700, and it got reduced to 2,600. And the results comparing to other studies, uncorrected visual acuity of Cornea and et al. Studies was 0.9 logmar units, and best corrected was 0.15 logmar units at 6 months post-op, and Sherry, Fetch, Emira et al. For logmar, uncorrected visual acuity was 0.15 logmar units, and best corrected was 0.15 logmar units post-op 6 months, and these are our results. And from this we can say that toric PCIOLs can be used to correct high myopic astigmatism with stable keratoconus, and uncorrected and best corrected were markedly improved after implantation. And the manifest spherical equivalent of Sherry, Fetch, Emerald et al. Was minus 0.3 post-op 6 months, and ours also was 0.03 at 6 months, and as manifest astigmatism was minus 0.6 at 6 months for Sherry, Fetch, Emerald et al. And ours also was minus 0.3 log diopters. And from this we can say that mean manifest spherical equivalent and mean manifest astigmatism decreased significantly post-operatively. And endothelial cell count also, there was only a reduction of 200 cells per millimeter square at 6 months in all the studies, and efficacy and safety index was also good. From this we can tell that toric ICL implantation was effective, predictable, and safe to correct refractive error and in patients with stable keratoconus. We conclude that we came to the point that implantation of phakic IOL is an effective, predictable, and safe option to correct refractive error and to improve visual acuity in patients with stable keratoconus and regular cornea. But we also compared endothelial count pre and post posterior chamber phakic IOL implantation, which was found to have positive correlation, but need further studies with longer follow-up to have a further conclusion of the safety. Thank you.
So which phakic IOLs you used?
We used Vision for toric ICLs.
Okay.
So all the patients.
So you didn't see any other major complications?
No, because the follow-up was only 6 months. So we need longer follow-up to see any cataract formation, glaucoma, any further
Yes.
complications.
And was these keratoconus patients, their cross-linking and all was done for them?
Yeah, 1 year before, all the patients were done 3 years before 1 year, and we checked for progression. If there is no progression, only we taken for ICL.
Okay. So after 1 year of cross-linking, you have done ICL.
Yeah.
So the cross-linking changes, they progress up to 3 years. So you have done after 1 year.
1 year.
Thank you. Thank you.